I am Randy Aldridge, and thanks for joining us for this edition of our candidate series. We've got Dr. David Hill, who is running for North Carolina Senate District 7. Dr. Hill, thank you so much for being here today.
Randy, thank you so much for having me. It's an honor.
I really have to ask you this, and I ask all of our candidates this. What on earth made you decide to run for office?
You know, my wife asked me the same thing, Randy. I have been advocating on behalf of children and family health with the North Carolina Pediatric Society and the American Academy of Pediatrics for 20 years, almost since I got to this state. One thing that we know in pediatrics is children cannot speak for themselves. They are totally reliant on their environment, on the adults. So when we're taking care of a child, we can go in the exam room, treat the illness, sure. But we're also asking about, do people in the house smoke? Do they have pets? Are they in a safe neighborhood? Can they get healthy food? Is there violence in the household or in the neighborhood? Are they going to a school that's meeting their needs, right? What we know is that health does not just occur in the exam room. It occurs in all of society. So number one, if I want to do my job as a pediatrician, it is time to get outside the exam room and into policy. Number two, I have noticed a trend over the last few years that the legislature in this state and others has decided that they want to control some aspects of healthcare. They want to have a say in women's reproductive health. They want to have a say in how we deal with children and families struggling with issues of gender. In increasing ways, the legislature is starting to practice medicine. And I am very concerned about that. So to me, the answer is it's time for me to go practice legislature.
We say this all the time in this building. It's lawmakers seems to be in the exam room more than ever.
Yes, and that is an issue that concerns me, and I imagine it concerns all of my colleagues, because no matter where you stand on these issues, we know that they are complex, they are subtle. When we are using our training and our knowledge and our empathy to deal with a family in distress, a person in danger, it's really complicated. And people who don't do this, I think, have no idea how hard it is. And when they come in, they're using a sledgehammer where really you want to be using surgical instruments.
I get it. I want to talk about several things because you're District 7.
Yes.
You practice in Goldsboro, New Hanover County, the Greenville area. You travel a lot in that area, so you see what this question is about. Rural areas in North Carolina.
Thank you.
There's a great disparity. There's lots of people who live in rural areas who have real difficulty getting, not just getting to healthcare, but getting healthcare at all.
Absolutely.
If you're elected in the legislature, what are your plans to close those gaps?
Thank you so much for bringing that up. Working as I do in Goldsboro, North Carolina for UNC Health Wayne, I have seen firsthand entire service lines, particularly the pediatric service line, not babies, not newborns, but older kids, closed down for lack of resources, lack of nurses, lack of beds, lack of support. That is crushing to me. I have also worked in a clinic that served the rural outlying areas of southeastern North Carolina. So I've seen what the impact is on these families. This is an urgent problem that we must address immediately. As we address it, we need to think of short-term solutions and longer-term solutions. The short-term solutions, I think a lot of people know about, but we need to redouble those efforts. We need loan repayment programs for physicians who are willing to work in these areas and set down roots and fall in love with them and stick around. We need incentives for independent medical practices. We have seen so many of our pediatric colleagues and others have to close independent practices and roll into larger corporations. Those corporations may have no desire to be in these places, but the docs who grew up there, who have roots there, do. So if we can support these independent practices, we can keep doctors in those places. In the long term, we need to invest in training, not just invest in training doctors like some of the ones that I see from the Campbell School of Osteopathic Medicine or the UNC School of Medicine, where I'm on adjunct faculty for both, but also nurses, radiology techs, respiratory therapists. Everybody in medicine knows we don't do this alone. This is a team. And if any member of the team is not there, we can't do the thing. So we need these long-term investments, but we also need some short-term solutions, because right now the rural areas are really hemorrhaging the care that they need to keep these places vibrant and thriving.
Well, something that happened that we're very proud of here at the Medical Society late last year is the expansion of Medicaid.
Yes.
Which brings Medicaid to people in many of these rural areas. That was a big deal, but it feels like a stepping stone. What do you think is the next thing to do now that we've secured that? What's the next step?
Well, first, I have to thank the legislators who worked so hard at hammering out a consensus to get this done. We celebrated so hard in the pediatric community when this came about because
we did the same thing here.
Didn't we?
Yes.
This helps our families so much. That's the kind of legislator I want to be. Mm-hmm. I have no need to stand on any particular ideology. I'm coming in to solve problems the way that problem got solved. But we've started solving the problem. We're not done. Now the money is there. Great. But does that mean patients are getting care? Does that mean they're getting health? Or does that mean they just could theoretically pay for it? So I think we need to look at the pay scale for Medicaid. I know a lot of docs who still won't take Medicaid because if they do, they can't keep the lights on. We need to bring that pay scale up. We made some major steps in 2018, helping to bring the pay scale up to Medicare's pay scale in some circumstances. But I'd like to see it equal to the pay scales of the private payers. I want everybody to fling their doors open wide and put out a sign that says Medicaid, welcome here. And then on the back end, we need to see what sorts of interventions are working to improve health and double down on those. And if there are pathways that people are taking that are just wasteful, they're not making the difference we need to see, okay, forget that. Let's put the money where it will do the most good for the most families.
You just mentioned the back end. So this is a big issue that we've been talking about here at the Medical Society. And quickly in the time that we have left, it's prior authorization reform.
Oh, gosh.
Quickly, because I know you've probably got lots of thoughts on this.
So many thoughts. Right?
Yes. So let's talk about, if elected, where do you fall on all of that?
Well, let me tell you, Randy, my experience has been from both sides. First, I am as frustrated as all of our colleagues are at making these calls, clicking these boxes, thinking, oh my, why are they making me do this? I have also sat on advisory committees for pharmacy benefits managers. I just recently stepped down from a physician's advisory committee for one of our Medicaid managed care corporations here. And I know that they too see this as a source of potential inefficiency. So I'd like to hold up one example of the sort of thing I would love to see. Randy, I lived 8 years in Texas. And one of the things I'd love to import from Texas is this gold card program that they have for prior authorization. So if you're a doc who calls in 20 times, you never get your prior auth turned down. They're like, why are we still making this person call? Mm-hmm. We know they're going to be good. We're going to approve it anyway. Why should we put everybody through this? So I would love to see a program like that. I know that the company I was working for also wanted to solve this problem, and they'd bring it up in the room full of some of the most amazing clinicians I've ever sat with, really thoughtful people, and say, do we really need to get a prior auth for this thing? And often we'd say, no, we're going to approve every time. We're going to approve. This is standard of care for this problem. Take it out. One of our payers here has pledged a 20% reduction. Personally, I think that number's a little bit of a low target, but I'll take anything I can get in their prior auths. I think if they succeed in that we should say, look, they did this. They didn't go bankrupt. People are still getting good care. Let's build on it. So there's so much room to solve this problem in a way that helps clinicians, payers, and patients. Let's get after it.
And I bet you will talk to people more about that on your website.
I will. That website.
Yes, there you go.
That website, Randy, is hill4ncsenate.com. And I hope that our listeners and our viewers will check it out, see what our policy positions are, and please volunteer, contact me. I want to know what you think so that we can do this job to benefit everyone.
I appreciate you taking the time to talk to us very much. Very passionate. All right. You can check this interview out and the others of our member candidates at our website, ncmedslack.org. Thanks for joining us.